actually stopped, and then I stopped. I had never felt so vulnerable in my life.
I think he thought that it would never happen to him, you know, that he was sort of invincible in a way.
It never dawned on me that I could possibly be having heart problems. I never thought I was a candidate for heart disease because I was a female.
I've got 4 kids. Hopefully I'll have grandkids sometime. It is very important to me to keep my health.
If you have had a heart attack or are at high risk for coronary heart disease, you should know that you can take an active role in managing your condition and staying healthy. There are steps you can take to lessen the risk of heart attack.
Had my wife not been in the room, I guess I wouldn't be here to tell the story.
The antiquing rolls down the
I was reading my mail, and it wasn't making any sense to me. And then all of a sudden it just like went like that, stopped. And I felt myself just shut down.
Immediately, I called 911 because I knew that I had to do something. I had to start working on him. He wasn't breathing. And when I first gave him mouth-to-mouth, I got a really good breath into him, and I held his nose, and I could feel his lungs inflate. And then after that, then he started to breathe.
And the next thing I knew, I was in an ambulance on my way to the hospital. And the guy said, "You're okay right now. We think you had a heart attack."
Guys want to listen to your heart? When a person has a heart attack, what is happening is that part of the heart is suffering damage, and it is dying. What is causing the damage is a lack of blood flow to that region of the heart. Another name for a heart attack is myocardial infarction.
Have it here. You can have it all the way up to ceiling. After we did the catheter test, they told me that my main arteries were clogged, and that's what shut down my heart because the blood couldn't get past those blockages. Yeah, it fits real nice. And we're going to cut this out here, and we're going to have the air conditioner come through.
Healthy coronary arteries are one of the keys to a healthy heart. When a coronary artery becomes blocked, it is unable to supply blood to the heart. Atherosclerosis is a gradual process in which fatty deposits build up in the walls of the arteries. It is especially serious when atherosclerosis happens in the coronary arteries because that can lead to a heart attack.
Well, one of the things that I got a real sense of after my heart attack was that how precious your life is and how immediately it could be removed from you. When I came out of the heart surgery, I didn't ever believe I could be back to normal.
This terrible pain. It started in my chest and it went down. It actually went down into my arms. And I lay there and I really got scared.
Once atherosclerosis has progressed enough to substantially threaten regular blood flow to the heart, some people experience chest pain or angina. This is not a heart attack, but it is a serious warning sign that you're at risk for a heart attack. This pain is typically experienced as a heaviness or tightness in the chest, sometimes radiating to the arms. This pain should always be brought to the attention of your doctor.
After I had the chest pains, I went to see the doctor. He told me it sounded like angina. He also told me my cholesterol was high. In addition to giving me medication for angina, he said to me I had to change my way of life because of the heart disease and elevated cholesterol.
The goal is to control your risk factors especially in your case, your cholesterol, so we can keep you stable. Okay. Lots of people know their total cholesterol, but what is really more important than the total cholesterol is the different types of cholesterol that make up the total, primarily LDL and HDL cholesterol. LDL, or bad cholesterol, can gradually build up in the wall of an artery. HDL, or good cholesterol, helps clear out the LDL from the artery walls. Therefore, it is dangerous to have high LDL cholesterol and low HDL cholesterol. When the LDL is too high, the atherosclerosis worsens in your arteries and blood flow is reduced. This buildup of cholesterol is what causes the coronary arteries to become blocked. High LDL cholesterol is not the only risk factor for heart attack. There are a number of risk factors you can control. These include hypertension, smoking, and diabetes. There are other risk factors too. Some you can't control, like your sex and age and your family history. You should talk to your doctor to find out exactly what risk factors you have. For people with high cholesterol who have had a heart attack or who are at risk for heart disease, changing to a low-fat diet and increasing exercise is a good beginning to controlling cholesterol.
Maybe if you're not used to eating vegetables and salads, it would be helpful for you to include more
My
vegetables.
dietitian suggested that I cut out red beef, that I increase the fruits, the salads, that I decrease or eliminate all fried food actually, and that was drastic enough for me. But I knew that I was doing something for myself, so that helped me. My doctor said to me that exercise was as basic as eating. He said every day I should, if not run, walk fast, not have such a sedentary life. The one thing that has helped me is my 11-year-old daughter. My daughter has learned that cholesterol is pretty bad, and she's really, really after me. So she takes me out riding on a bike every so often, which is great. Okay, you make it a little faster?
The National Institutes of Health has convened a panel of experts called the National Cholesterol Education Program, or NCEP, to recommend guidelines for managing cholesterol. These physicians and scientists have recommended the following levels of LDL cholesterol. They vary according to your risk category. For people with no history of heart disease and fewer than 2 risk factors, the recommended LDL cholesterol is 160 or less. People with no history of heart disease, but with 2 or more risk factors, should have LDL cholesterol of 130 or less. People with heart disease, like Joel and Sandy, should have LDL cholesterol under 100.
My doctor told me that my condition was hereditary, and one way to control my high cholesterol was by changing my diet. I really never worked at anything so hard in my entire life.
Diet is something that everyone with coronary heart disease can control. Shopping wisely, paying close attention to the fat and cholesterol contents of the foods you choose can make a significant difference in your health and sense of well-being. By calculating your LDL level, your doctor is able to determine whether you need treatment to lower your cholesterol. For most people, adhering to a low-fat diet will lower LDL cholesterol 5 to 10%. For some people, that just isn't enough. And you did have some response to diet, but not quite where we want it to be. There is evidence that regular exercise diminishes the risk of heart disease. Depending on your age and relative health, an exercise regimen should be tailored to your needs and capabilities. You should talk to your doctor about what sorts of activities are right for you. If diet and exercise prove to be insufficient, the NCEP recommends the addition of medication to lower your blood cholesterol. Don't forget to take your medications, okay?
I had to take this medicine every day for my hypertension. But then my doctor told me I also had to take medicine for my high cholesterol. It was a real pain at first.
It's important to take it at the same time every day. If you're feeling any unusual effects, you should give me a call, or you call your doctor and speak to him regarding the medication.
Thanks a lot.
Okay.
This thing here. This one time I just forgot to take the pill. And I didn't take it again, 2 or 3 days, didn't take the pill. I felt great. So I thought I didn't need it anymore. I thought it had done its purpose. Well, needless to tell you, I went back to the doctor and the cholesterol had just gone up incredibly again. I realized how important it was to keep taking it. It's a habit. It's a habit. I take it every day and there's no problem.
It was very difficult for me to remember to take the medication, but then I got one of these pill boxes that told me every day of the week, and then once a week I'd put my medication in each slot so that I would remember to take it, and then I'd take it at the same time every day.
If it becomes necessary to add medication, it is very important to carefully follow your doctor's instructions. People who have had a heart attack or who are at risk for heart disease can make a difference in their condition. The goal is to reduce risk by controlling risk factors. This tends to improve overall health and quality of life.
I realize now I'll have a healthier lifestyle as I get older with the support of my wife and helping me maintain a good diet, having a good exercise program, and following the advice of my doctor and taking my medication every day.
It seemed like it was going to be very hard to live this new way of life with this new fat-free diet, eating differently, exercising, taking medication daily. But I have succeeded. I've taken off 15 pounds, which I'm very proud of, and I do feel better.
After taking the pills, changing my diet, doing exercises, and doing all the things that psychologically help you as much as physically, it's great. It's a whole new life.
To reduce your risk of coronary heart disease, you have to be disciplined and committed to making lifestyle changes. If you have high LDL cholesterol and you've already had a heart attack, like Joel, or if you've had the warning signs, chest pains or angina, like Sandy, you are at risk for progression of coronary heart disease. People like Henry, who haven't had heart problems, are also at high risk because they have high LDL cholesterol and at least 2 other risk factors. And remember, the most important part of a comprehensive risk reduction strategy include diet, especially a low cholesterol, low fat diet, regular aerobic exercise, and if it becomes necessary to add medication, it is very important to carefully follow your doctor's instructions. You should also consult with your doctor on a regular basis. And I think the thing you have to remember is that we're going for the long haul here. By working with your doctor, dietitian, and pharmacist, you can reduce the risk of coronary heart disease. Making a commitment and taking control of your health is really up to you.